Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Happy day, welcome back to Healthy Living. Tonight we are talking about improving your complexion. Express Care's Dr. Jitka Lom joins us now to give us some tips and advice on the topic before we take you into the clinic to see some of the procedures that are done to improve your complexion. Thanks, Doc, for coming in. So what is let's start with what's a good facial regimen for somebody maybe who has complexion problems?
Yeah, you know what? Most of the things are really simple. Wash your face twice a day with warm water. Use a mild, gentle cleanser. You can pick Olay or Cetaphil or even just liquid Dove. The liquid cleansers tend to be milder and gentler, and you don't want to be digging and scrubbing at your face in general. People tend to over cleanse. Just you're trying to take the surface debris off your face. So morning and night, wash your face. In the middle of the day, several times, 3 or 4 times a day, please put on sunscreen if you're outdoors or driving your car. And you should use an SPF 30, and that's a great start. And then you look at what improves your complexion. It's the things that make your skin look more youthful. So if you look at a child's skin, it's thin, the color's even, the pores are small, and there's no wrinkles. So we aim towards that through the products that we use, which are generally some creams or sometimes other treatments that we can do to reverse that aging process.
Okay, so on a regular basis, what would you suggest, aside from the sunscreen?
Yeah, aside from the sunscreen, you can exfoliate, meaning take the dead layers of skin off your face every, let's say, at least not more than once a week. Every other week you can do that. There are over-the-counter scrubs you can buy. Again, you don't want to be too aggressive. You can buy over-the-counter mild chemical peels also. You can buy products with glycolic acid in them that do really light exfoliation for you, or you can have a stronger treatment. But that removes dead layers of surface skin which make your skin look dull and sometimes not as clean as it might look otherwise. So by removing that, the light will shine off of it better and will look better.
So are masks safe to do? And
masks are safe to do. All they do though is hydrate your skin. I guess one thing I should have mentioned is moisturizing. People that have dry skin or combination skin, their skin's a little bit oily but dry in patches, should moisturize in the evening before bed. One thing that really doesn't do a whole lot for us though is toners. A lot of the cosmetic companies sell toners, and really there's not a lot of point in that. It changes the pH of your skin only briefly, and it's really not worth the investment in my opinion.
Okay, good to know. So moisturizer and sunscreen are a must on a daily basis. And so what is the best way to deal with acne? I know that's one of the things that a lot of people, when you talk about complexion, that's one of the biggies.
Yeah, people get really upset over the blemishes. Acne is actually it's a disease, and it tends to be a chronic disease, meaning it goes on for a long time, either in children, adolescents, or even in adults. It's sort of got a few components. It's got a hormonal component, it's got a bacterial component, and an oil component. So the things that you can do something about at home is de-oiling. You can wash your face twice a day, and then you can buy little blotting papers. They're like little oil blotting papers, and you can use that to remove the oil from your face, and then there's less for bacteria to feed on. And then as far as over-the-counter products, you can pick up something with benzoyl peroxide or salicylic acid. These are products like Clearasil, Clean and Clear. These are pretty good first starts taking care of mild acne. But if it's not taking care of it, then you really do need more intensive treatment prescriptions because it can scar.
Okay, and so we talked a little bit about sunscreen as well. Just briefly again, SPF, UVB, UVA.
So just look for SPF 30 and broad spectrum protection. Just remember those words, broad spectrum and SPF 30.
All right, good to know. And how does microdermabrasion, I know that's something that Express Care offers, and we're actually going to show our viewers how this is done. You did a procedure in your clinic, but how does this help improve somebody's complexion?
Right. So microdermabrasion is using a small wand with a diamond tip abrader, and it's got like a suction on it, like a little vacuum cleaner. And what it does is it smooths and polishes the skin. So you're removing, again, top layers of dead skin, removing debris, removing oil from the surface of the skin. And it doesn't hurt. It feels very gentle, and your skin will be just kind of pink afterwards, but look cleaner and fresher and brighter. And by doing that, you also improve the circulation in the face and the skin, so you'll get a better oxygenation of the tissue, and it helps you look better. It's not something that will last forever, a long time, but it's a nice way to maintain your skin.
Okay, and so who do you also do chemical peels.
Right.
So who do you suggest? Is it something that you suggest on everybody? For chemical peels and microdermabrasion?
No, not everybody, but it's a maintenance thing. So for chemical peels, we use that a lot for people with acne because it will dry up those juicy pimples. It also helps with color. Yeah, it does. And then we also use it for color. So if people have uneven color or pigmentation problems, we can use chemical peels to gradually lighten the skin. It's very gentle. Again, it doesn't peel like a snake. It's just kind of a little bit pink and sometimes a little dry. Yeah, and then we use it for de-oiling, for color, and for acne. And it can be used, again, as an ongoing maintenance thing. So sometimes we'll alternate to microdermabrasion chemical peel, and we'll do it every couple of weeks. Most people, once a month, once every 6 weeks, they can use it for maintenance.
Okay, so any last tips that you have before we throw to the video, and any last tips for people on ways to keep their complexion looking good or improve
Another
it?
really simple thing they can do is drink lots of water, you know? And a final thing would be to avoid the really heavy, cakey makeup, because again, that can really plug up your pores and actually keep reinfecting yourself with bacteria. So a lot of the young teens will sort of have their hair covering their face and tons of makeup, and all of that brings more oil to the face and makes it even worse. So you want to pull your hair back and keep that oil away from your face as far as makeup also.
All right, sounds good. Thank you, Doc. And I know you've done hundreds of these procedures.
Yeah.
They're safe, they're easy for people to do,
Yeah.
and it not only improves their complexion but also makes them feel better, which I think is a great thing. So tonight we have a special treat for our viewers. We actually took our cameras inside the Express Care Clinic so that we could actually show our viewers how easy and simple these procedures are. So let's take a look at microdermabrasion.
Now we're going to do a microdermabrasion. This is Norman, and we often have men coming in to do procedures as well. It's very nice to keep your skin fresh and youthful looking. Microdermabrasion helps remove surface impurities, clean out the pores, and smooth the fine lines of the face. It's a painless procedure that can be done in 20 minutes over your lunch break, and you can return straight back to work. Norman, what we have here is a diamond tip wand with the suction attached. What the diamonds on the surface do is abrade the skin, and then the vacuum cleaner sucks up the surface impurities from the pores. Here we go. It's a very gentle procedure. We're just using the wand to move gently across the skin and take off the surface layers of skin. And you can sort of see the very fine flakes that are coming off of Norman's face. How are you doing, Norm?
I'm good.
You having any pain at all?
No.
No. This is a perfect treatment for people with acne, with deep pores that need to be cleaned out, or people that just want to keep their skin looking very fresh and youthful. It can be repeated once a month. There's absolutely no downtime at all. What we can do is just wear sunscreen and return immediately back to work or your regular activities. We're now going to move to your cheek area. Just turn your head a tiny bit this way. There we go. It's a very gentle procedure. There's a little bit of suction, but it's not painful at all. Can you see those dry white flakes coming off the face? We're removing top dead layers of skin so that the fresh, young skin can be present underneath. And again, we're just gently suctioning out all the material that's inside the pores. After this gentle cleaning procedure, the only aftercare is wearing sunscreen and staying out of the sun.